I showed you how to use the roller and the balls to massage your back and massage your legs, and every tool has a region where it's more effective. Now we're going to talk about the foam roller. So the foam roller is not the easiest tool to use. It's a bit less, it's a bit more difficult to bring with you all over anywhere, to use in any place, but it is effective for a certain region. Now, it has often been used to massage the outside of the leg. It's probably the place where it's the easiest to use it and the more effective. So I'm going to show you how to do that. Also, how to massage the rest of your legs. It's not as easy or as effective. It's a lot of effort to use the foam roller, but it's well worth it for the exterior of the leg. It's also really a very good tool to massage your upper back. The lower back you have to be more careful with. It's already an extension, so you don't want to bring it even further. So it's just, you have to be careful. I have a few patients that overdid it before I could explain it to them how to really use the foam roller, and they saw other people use it, and they have a tendency to just overdo it and to do it too fast, also to go too far too soon. So what you want to do with the foam roller for your back is you want the back, all of the vertebrae, to follow slowly the form of the foam roller. If there are regions where it's too tense, too stuck, and you try to go into extension too quickly, what happens is, instead of slowly taking the form of the roller and just like going on the roller and slowly every joint is moving properly, it's going to kind of kink in two, and you're going to put too much pressure in certain spots, and it's going to want to bend too much in places where it can't bend that much. So it has to be really homogeneous stretch to the joints. So I'm going to show you how to do that also. So first up, the legs. So here we go. Now the outside of the leg, like I said, was probably the first spot that it was used for. Very, very efficient for that. You want to put your weight on it and just massage the outside of your leg. You can massage the IT band, so the iliotibial band, and also the vastus external. So it's a part of the quadriceps, very efficient, and that's what's really painful in this massage. It's getting into the muscle there. So very easy to do. You can also use it on the glutes. Not very efficient on the glutes. It works, but there are certain rollers that have have bumps, like really thick bumps, that you can use, and that'll be more effective to dig into the glutes. Also for the TFL, which is the tensor fasciae lata, is a muscle that's very important to do. It's much more effective with the balls, but you can also do it with the roller. Again, with the rollers that have bumps on them, like deep bumps, well then you can really get into that muscle and make it worth it. But this is again a lot of effort, and you can't bring it all over with you. It's not as easy as using the hand rollers. For the hamstrings, again, somewhat effective. You're kind of just putting your weight on it. You can do both at the same time. You're splitting your weight in two, so it's not as effective. You can put both your legs on the roller on top one of each other and just massage the hamstrings. You can do the same thing for the calves. So you're just going, you can do both. You can put one over the other and dig in a bit more. So that's somewhat effective. Also, you want to be careful for the tendons and the bone. You don't want to massage the bone too much, but usually it's not too painful. You can also do the inside of the leg, the inside of the quadriceps, but it's a lot of effort, and you have to kind of twist a lot to get it to massage. So I suggest that you use the hand roller. It's a lot easier for the quadriceps. Let's move on to the lower back. So the lower back, you can do it. It's not going to massage that much, and you can't really extend too much because you want to be careful not to pinch your vertebrae even more. So you can do it a bit. It does release a bit, and it can be a good first step. Sometimes they're just starting to loosen up the lower back. Where it's more effective is the upper back. So just be careful that you're doing it properly and you're not going too fast. So you're staying in a crunch position, and slowly, when you feel that your back can slowly really take the form of the roller, you can slowly let it go deeper. You can even do certain spots one at a time and just
go a bit deeper. But you really have to feel that it's not moving too much at one spot, that you're really
getting the whole back to kind of roll slowly onto it, and it's releasing. It can crack. It doesn't really matter if it cracks though. But if it's cracking in a way where it's really just bending too much in one spot, it's going to be painful. But if you do it really, really slowly, it might crack a little bit. Ideally, what you want is that you do it really slowly. You massage the balls first, maybe, even if it's too tight. And then when you're rolling on the roller, it's going to just go further and further, and it won't need to crack. So just make sure that it's feeling comfortable. So those are the best uses for the roller. So like I said before, the foam roller. So every tool has a region where it's more effective, and you can use them for pretty much everywhere. But when you have all of these tools, you can be more effective in really releasing certain tensions.